The reason why orthodontists are involved in treatment of sleep disordered breathing, such as obstructive sleep apnea, is because the jaws are the only bones that sustain the airway to some degree. Humans are the only animal in the animal kingdom that have such a long airway that is not sustained by skeleton. And God made us that way, so we are able to speak and pronounce words. However, because of that, the airway is more prone to collapse. So it's important to start with a bigger airway. The bigger it is, obviously, the harder it is for any collapsing tissue, soft tissue, to completely block it to where we now develop obstruction when we sleep. The reason why orthodontics are orthodontists are involved in this is because we're not just orthodontists, which are tooth movers. We're also dentofacial orthopedic doctors, because we expand the arches, the jaw bones. So in children, in children that need it, okay, we're not going to do this on everybody. There's, all the treatments will obviously have first a diagnosis, right? So if the diagnosis is that the jaws are constricted, then obviously we will expand them. Expanding the jaws will also help open the airways. And we have treated many children suffering from ADHD symptoms and snoring and problems at school, where as soon as we expand and we open the airway, they're able to sleep better, to breathe better at night. They're able to improve their performance at school, and just sometimes if they are on ADHD medication, they're able to get off of that ADHD medication, because unlike adults, children with sleep disordered breathing will be hyperactive and not necessarily just really sleepy. So sometimes it's hard to make the differential diagnosis between sleep disordered breathing and ADHD, and because of that, a lot of children are underdiagnosed for sleep disordered breathing. So I am very passionate about this. We do 3D imaging measurements of the airway for every single orthodontic appointment consultation. So we want to make sure that our orthodontic treatment not only improves the airways, not only does not restrict the airway, but also improves it to set them up for success. And for adults who are diagnosed with sleep disordered breathing, there is oral appliances that we can use. And these oral appliances are basically the same type of appliances that we use in children to influence their growth. But now that its growth is completed in adults, these orthodontic appliances used in adults will just reposition the lower jaw in a way that it opens the airway to make sure that the patients can sleep and not have collapse in the airway, and they're able to breathe and they have oxygen for all of their tissues. And so the oral appliances for adults that suffer from obstructive sleep apnea are basically a different option from CPAP or autopaps, just because a lot of adult patients cannot get comfortable with a CPAP. Another way that orthodontists are involved in treatment of sleep apnea, sometimes the obstruction is truly because of the jaws that have not grown. Either the upper or the lower jaw have not grown enough, and these adults as children haven't gone through all early orthodontic treatments. So now here we are, growth is completed, but the jaws did not grow as far forward as they needed to in order for the airway to be big enough to not collapse. So this is a treatment that we do as orthodontists in collaboration with maxillofacial surgeons. It is for severe sleep apnea because it involves surgery as well as orthodontic treatment. However, for these very severe patients, this is in over 95% of cases, this is a complete treatment of the obstruction, meaning these patients don't need to sleep with a CPAP. These patients, after the surgery combined with orthodontic treatment, don't need an oral appliance. So a CPAP, an oral appliance, is managing the disease. If you have them on, you're not gonna collapse when you sleep. But if you don't have electricity, or you went on a trip and you left your appliance at home, you're still having the disease and it's not managed. When you have the surgery, and again, we only do this for severe cases, in 95% of the cases, you will not need a CPAP anymore. You will not need an oral appliance, so you are fully treated. There are several other surgical procedures, ENT and whatnot. All of their success is anywhere between 30 and 60%, and a lot of those are, there is relapse. So if there is a severe sleep apnea and a patient is agreeable to go to surgery, I recommend that they do the maxillomandibular advancement in cooperation with orthodontic treatment because it has the highest rate of success.